Meanwhile, we can start talking about some stuff that we need to do in order to start moving forward. We're talking on the Newsmaker line with Dr. Cleamon Moore Jr. He is the president and CEO of American Advantage Home Care Incorporated. He's in and around Metro Detroit, and he's got some really good ideas about recommendations of the president's $400 billion allocation to home health care for seniors from the inside out. Dr. Moore, good morning and welcome to the program. Hope that you're having a good start to your Tuesday. How are you?
I'm doing well, Doug. Good morning to you and your listeners. Thanks for having me this morning.
You are very welcome. One of the things that you recommend is something we're seeing everywhere. It doesn't matter whether it's high tech. It doesn't matter whether it's truck drivers. Doesn't matter whether it's people to serve cocktails or dinners at restaurants. It's gearing up to get the workforce needed.
You got it. Yes, sir. We got to get a pipeline going, Doug. Granted that by 2030, there'll be 74 million seniors living in the United States that may need some care and assistance. We got to get these high schoolers and college students on track to be some good caregivers.
It's interesting because for me, one of those things is that I've worked with an organization. We talk about not every student is cut out to be in academia. You have some students that are cut out to be academics. They go through the 4-year and maybe even further. You have some students who will go and they will become entrepreneurs. You have other students who will go into the trades. And for this home health care kind of thing, I think of it sort of a combination of trade and academics because you learn a little bit of both in this.
You sure do. You sure do. And then some kids will just be a little more innate, Doug, and ready to go right into the field from taking care of a aging parent or a grandparent. So it turns into a natural fit of a little bit of the books, but more so of getting the heart and mind engaged to give back and take care of those seniors.
One of the things that we're not going to talk about, we've talked about in other cases, the tax-based incentives or credits for senior-friendly home upgrades like access ramps, generator power supply subsidies, fall prevention. That's good, but I need you to explain the number 2, a virtual set of ecosystems for senior and caregiver application developments to connect providers, EMRs, and family members. Explain that, would you please?
Gladly, Doug. So if you can recall the fall preventions, the Phillips Lifeline, the necklace. Hey, I've fallen and I can't get up.
Oh yeah.
If we take that full circle to 2021, going to 2022, the platform is on the phone now. So It's not about that pipeline of pushing the television commercials. I've fallen, I can't get up. But let's make sure that loved ones, caregivers have an app on their phone to be able to communicate real time with their parents, doctors, and caregivers. So,
and even integrating smart home, the internet of the future, right?
You got it.
Yeah, that'd be something that'd be remarkable to be able to pull in as well. You talk about continued child care support, Dr. Cleamon Moore Jr., tax credits and subsidies to working caregivers. Why is this important?
Well, when you look at the wage, we're having this national debate about a $15 minimum wage. In some cases, Doug, whenever a person is in the house providing care, they're in there for over an hour. They're in there for an hour and a half. So when you start to look at $15 to $20 to take care of 6 or 7 patients a day, sometimes it's just so difficult for the ends to meet. The caregivers are away from their children for so long. So a little help with daycare and child care could go a very long way to encourage these folks to keep at the grind.
That good, fabulous voice, by the way. I absolutely love your voice, which is why you've got a podcast you hit up twice a week. Dr. Cleamon Moore Jr., he is the author of From Failure to Promise, 360 Degrees, a best-selling author at that. Dr. Moore, thanks for joining us here on The Morning Show.